I'm Leonie from the University of Manchester, and this paper presents my work on assessing the economic impact of potentially inappropriate prescribing of Nsaids in patients with oral anticoagulation using routinely collected healthcare data. We used the state transition model on this slide to follow patients with anticoagulants and simulated the process of adverse events associated with hazardous prescription of an Nsaid. The model presents different health states, and arrows show possible transitions between these states. Each patient starts in the no adverse event state. From there, they can transition to other health states when they experience an adverse event or stay in the same health state. In this example, the fit woman in denims experiences a stroke. Depending on the severity of each health state, the cost and quality of life measured in QALYs differ. Our fit woman in denims just had a stroke and is in hospital. She generates higher costs and her quality of life is lower compared to those in the no adverse event state. Patients are followed until they die, and depending on how long they stay in each health state, they generate different costs and QALYs on their journey. In the end, we estimate the difference in cost and QALYs between anticoagulated patients with and without Nsaids. To demonstrate the impact of Nsaid use, we need to know the increased likelihood of these adverse events attributed to the Nsaid. No such data existed for the UK. That's why we conducted an observational cohort study using routinely collected health data. We followed anticoagulated patients with and without Nsaids to estimate the increased likelihood of adverse events associated with Nsaids. This data was then used to see how likely the fit woman in denim is to experience an adverse event in the presence or in the absence of the Nsaid. The model results showed that prescribing Nsaids to anticoagulated patients not only incurred higher costs, but also reduced quality of life.